I'm often asked whether hypnosis can help with medical conditions. I'll ask you, does the way a person think, what they feel, or what they believe about their medical condition have any bearing on the way they take care of themselves, the way they respond to treatment, the way they heal, or the way they perceive their pain? Most people will respond yes, absolutely. And they can tell me stories about how someone's mind, how their attitudes affected the medical outcome. If the mind can make a situation worse, then it can also make it better. And if the mind has anything to do with it, then hypnosis absolutely can help. Hypnosis is all about helping people change their minds and their attitudes. My name is Tamera F. I'm a Florida licensed mental health therapist, a national board certified counselor, and a certified clinical and medical hypnotist. I've been helping people in some kind of pain for over 30 years. And in that time, I've gathered a lot of experience and a lot of tools, and my absolute favorite are the hypnotic approaches. That might be traditional hypnosis, that might be neuro-linguistic programming, that might be mindfulness-based stress reduction or other mind-based strategies. I like these approaches because they work, and there's a lot of contemporary data that demonstrates their efficacy in medical situations. I like these approaches because they work quickly. Your patients will know whether or not they are being helped, and that makes it cost-effective as a supplement to medical care. Now, I can't help everyone, but I do help an awful lot of people make significant shifts in their focus and attention from ways of thinking and feeling and believing about medical conditions that are not helpful to them to ones that are more helpful and more hopeful. Even more importantly, I teach my clients how to use these tools for themselves. I empower them to do the best they can with the situation they find themselves in. As a healthcare practitioner, I'm sure you know that even a little bit of improvement for your patient can mean the difference between a life of frustration and anger, helplessness, depression, anxiety, and a life worth living. Now, I love working with people who simply want to take charge of their lives, but I tell healthcare practitioners that their best referrals to me are the patients with whom they are challenged. That might be patients who have pain or other symptoms that are not resolved through traditional medical approaches, at least not to the patient's satisfaction. That might be people with severe anxiety about their diagnosis, about their treatment, or about some specific procedure they're about to undergo. It might be stress-related health concerns. IBS comes to mind, as these respond very well to hypnosis. And it might be patients who simply need a little extra help with their behavioral health care choices, such as smoking cessation, weight management, or treatment compliance. I want to be clear, my hypnosis services are meant to be a supplement to your treatment objectives. They're meant to help what you're doing be even more effective. I want to become a trusted resource to both you and your patients. My business model is that happy patients and happy referral sources make a lot more referrals, so I'm very invested in working cooperatively with you both. I know your time is valuable, and I appreciate the time you've spent viewing this video. Know that referrals to me are easy. You or your patient can contact me via the number on your screen or through my website at tampabayhypnotherapy.com. Thank you.